Blindness separates us from things. Deafness separates us from people. That is a quote from Helen Keller. That is something you'll see when you walk through the doors at Hearing Well Matters. Great to be in here with Rob Hamilton. Hey, Rob. How are you,
Hi,
pal?
Tim.
Good
How are you?
Good to see you. That's important for you guys, right? It's important. Listen, hearing is obvious. It's one of our 5 main senses. I need it for my job. You guys need it for your job. You need it for your job. Do we take advantage sometimes of our hearing and don't realize how important it is?
Yeah, I think we do. Hearing is probably the most important sense for interacting with other people, and it also happens very gradually. Sometimes hearing loss, and so sometimes we don't even realize how much we've lost until a friend or a family member mentions it. So I think it is really underestimated how important it is.
The name of the clinic, Hearing Well Matters.
Yeah.
Pretty obvious statement.
Sure. Well, hearing well matters both in the short term, but also in the long term. In the short term, it's sort of obvious. It helps with your communications and how well you interact with your friends and family, but it's also really important in the long term for preserving our brain health. So when we hear well, our cognitive abilities stay stronger longer.
What's going on in here?
Well, this is Meredith.
Morning, Meredith.
One of our clinicians, and she's doing a hearing test on Jess in the sound booth.
Morning, Jess. How did you get into this industry?
Well, I suffer hearing loss myself. I have had it for about 10 years, and I actually wear hearing aids, so I appreciate what they can do to really help you hear better. Also, I worked at a hearing aid manufacturer for about 5 years, and that really allowed me to learn the industry, but also learn the importance for helping patients.
So the evolution too has really changed. Perception, has that changed?
I think so, yeah. The satisfaction rating for hearing aids today is well over 80%, which has increased significantly over the last 20 years. Okay. And so I think the hearing aids are a lot better than they used to be, and they really help in difficult situations.
Well, I didn't even know you were a hearing aid until you said it. Now I can just kind of notice it right now on your right ear, but like it should never be a thing. I know I say this all the time. My dad wears hearing aids every now and again, and when selective hearing, I think is what he has, is what a lot of people do have, sure. Right? When he wants to hear, he has it in. But let's take a break, because let's put me through a test, perhaps. Let's go through the technology a little bit, and like factors of why you might experience hearing loss, but also triggers of when that could be happening, because I don't know. It happens depending on the industry that you work in or recreationally what you're doing. There's a number of factors. We'll get into all that when we come back to Hearing Well Matters in Burlington. Pitch the straw through the door of the stable. The sink is the thing that we pile dishes. Morning, how are you? Welcome back to Hearing Well Matters. I'm getting my hearing tested. Great to be with Meredith. Hello.
Good morning.
Good morning. What is your role? What's your title?
I'm a hearing instrument dispenser.
Wow. Fancy.
Yeah, very fancy.
How did you get into this world?
I did my undergrad at the University of Guelph in gerontology, and then I decided to go back to Conestoga College for their 2-year hearing instrument specialist program.
Okay. What are you putting me through right now? So I'm hearing phrases in my ear.
Yeah.
With some background noise.
Absolutely. So the number one complaint that we get from patients coming in is that they're struggling hearing one individual person talking when there's background noise and other people talking around them. This is a quick SIN test, a quick speech and noise test, and it mimics those noisy situations with multiple talkers and background sounds, and gives us an idea how our patients are hearing in noise.
What are common factors?
Common factors is unbalanced hearing between your left and right ear. That can definitely help you struggle through hearing in noise. Okay. Locating sound is difficult when you're not hearing balanced in each ear and you're not hearing well. It's hard to pick out an individual voice amongst a crowd of noise.
So those would be some signs. When somebody's coming in here for the first time, are you getting to know them in their background? Because obviously age would be one reason, right? Occupation?
Yep, absolutely. Occupational noise exposure is a huge one for sure. And then general hobbies as well. Some people like hunting, they like riding motorcycles,
Right.
driving convertibles. That's all noise exposure that adds up over the years.
Hereditary?
Absolutely. Yep. There's definitely a hereditary component to hearing loss for sure.
Okay, so you're taking somebody through this test, which would take how long?
5 minutes.
5 minutes. But you in that 5 minutes, you can get a really good sense where that individual's hearing is at.
Absolutely. Yeah, we do 2 components of testing. There's a beep tone testing that gives us the severity and the location of the hearing loss, and then the speech testing gives us more of a lifestyle component to how they're communicating with others.
Okay. And then you can assess what they need going forward.
Absolutely.
Okay, let's take another break. Let's get into a little bit of the technology because it is really advanced, really
Yeah.
evolved. Maybe we can even mold something for my ear. Do you want to really crank up the background noise and see if I can
Absolutely.
crank it? And we can see how my hearing's doing when we come back. Hearing Well Matters. They're going to be at the Sound of Music this coming weekend, so keep an eye out for them there. They're in Burlington on Morning Live. Oh. Oh, that's hard. Do it again. Dine, shower down from all sides. Is that right?
Mm-hmm.
Wow, okay, yeah. One more. Put the card and slip it under the pass.
Mm-hmm.
Okay. Much earwax in there, Meredith?
Not too much at all.
Okay, good.
Looking
'cause
good.
I cleaned it out before I came because I knew she was going to be doing that. Good morning. Welcome back to Hearing Well Matters in Burlington. What about earwax? How are we supposed to get rid of earwax?
We want you to leave your earwax in your ears unless it becomes a problem. You're supposed to have some earwax in there. It's healthy. It helps keep your ears clean and safe from any debris or dust or anything like that. So earwax is good unless it's going to clog up your full ear canal and help hinder you from hearing.
Cotton swabs?
No, we don't like Q-tips.
We do
No.
not like Q-tips. No, I don't know, so at work, we're always wearing earpieces, so we're always sticking things in our ear, and like there's obviously some wax that builds up, and it affects it sometimes, and we got to clear it out. What are you doing for me right now?
We're going to do a custom ear mold impression. So I'm going to fill your ear with some putty here. It's going to harden in your ear, and we're going to get an exact replica of the inside of your ear when it hardens.
Who would this be ideal for?
This would be ideal for anyone with a profound or more severe hearing loss that we really need to seal the sound in with a custom hearing aid or a custom piece. That works well for people with dexterity issues. Those hearing aids are a little easier to manipulate, but we also do custom earplugs as well for prevention.
Oh, so that occupational factors that we talked about.
Yeah.
So if you haven't been watching this morning, so we did a hearing test on me. A-okay?
A-okay.
A-okay. A-okay. So we're just kind of demonstrating the different styles that they do. Because if you didn't do this custom, what would you put in here instead?
A universal silicone dome, which works really well for certain types of hearing losses. It's a nice natural sound, natural fit. But some people have a more severe hearing loss and they need a little extra help from a custom unit.
Okay, go for it.
All right, we're ready.
Okay. So this is going to go in there. Does it hurt?
No, not at all.
Oh, it feels cold.
We're going to come all the way up here, give the manufacturer as much information as we can about your ears, and then just fill this bottom bowl.
Are you always cautious when you're talking to clients about like saying things like, how did you hear about us?
Sometimes, yes. And I will always assume that someone can't hear me. So that classic joke of what, I'm always ready to rephrase and repeat myself, even though it's mostly a joke most times.
Yeah. Because because there are a lot of people that it's a sensitive issue, but it's an important one because it is one of our 5 senses. Okay, so we'll let this
Cure, harden, yeah.
harden. We'll take a break. We'll come back. We'll get into some of the technology and how things have changed when it comes to hearing aids here at Hearing Well Matters in Burlington on Morning Live. Good morning. Welcome back to Hearing Well Matters. And I can hear, oh, there we go. I can hear better now. Back here with Rob Hamilton. Okay, so when we last saw me, you were putting a customized mold in. So what do you do with that now, Rob?
So with this mold, we now have an exact replica of the shape of your left ear.
Okay, how's it look? Do I got a good looking left ear?
You sure do.
Yeah? You just say that to everybody, don't you?
No, it's a good one. It's captured both bends of the ear canal very well.
Okay. So we go from that, and then you would send that away to get an actual hearing aid for me.
Right. So so there's two broad styles of hearing aids, custom and then the behind the ear or receiver in the canal. And so with the ear mold, we were able to make a custom hearing aid like these molds.
These are all customs in front of us.
Yes, they're designed to fit exactly in the shape of the person's ear. And as Meredith said before, these are excellent for patients who have more severe hearing loss, where you want to keep the amplified sound in the ear.
You said that in a previous life you were in manufacturing of these type of devices. Do you use the same device or different manufacturers?
We use different manufacturers. We're an independent clinic, and so we have all the manufacturers here.
Because are there some better than others?
They're all strong in their own way. We look to individualize the choice depending on the patient's hearing loss.
Okay, so we have Meredith, who we met earlier on, but if you missed it, she's putting a hearing test towards Jess. Good morning, ladies. What makes you guys unique, you think, Rob, compared to some of the others?
Well, I've worked in the industry and I suffer hearing loss myself, so that's good. This is a new clinic. We opened it up only in 2020, so all our equipment is state of the art. We've had great customer reviews over the 2.5 years, and yeah.
What are some signs? Somebody's watching this morning. I don't know. A lot of it is it more men than women with hearing loss, just because of occupation a lot of the time?
Yeah, occupations and recreations.
So what if somebody's watching and saying, "Hey, I think you got some hearing loss." Like, what are some factors there?
Sure. Well, the TV is a great gauge. If you're listening to the TV louder than you used to, that could show hearing loss. If you're having difficulty hearing at a restaurant, hearing your dinner companion across the table and there's a lot of background noise, that's usually a pretty good sign. If you're having problems hearing from another room or another floor, or if people seem to be mumbling, or you have to ask people to repeat themselves, those are all the best signs.
And booking an appointment to really get it tested to see where you're at is
we
the key.
Yeah, we offer free hearing tests here at the clinic, and that's usually the starting point.
What about going to a music festival? Will that help your hearing?
That's great. Actually, the Sound of Music is this weekend.
Yeah.
Lots of bands over 4 days, and we're going to be there. We have a tent where
Telling them to turn it down?
we're going to be doing hearing tests there, free hearing
Are you?
tests
Okay.
in between the gigs on stage. So if you want to swing by our tent, we'd be happy to do a free iPad-based hearing test for you.
Awesome. Well, nice meeting you. Nice meeting you, Meredith. Nice meeting you, Jess. Thank you so much. We learned a lot. Hopefully you did too. Hearing well matters in Burlington on Morning Live.